I'm Alan Doederlein with the Depression and Bipolar Support Alliance, and we're talking today about triggers and warning signs. Thank you for joining us.
Thank you.
What are some types of triggers or warning signs?
Common triggers at either phase of the illness are often around sleep. And sleep is so important when treating bipolar disorder. And so if people can manage their sleep and have good sleep hygiene, for many patients, I say that's 80% of keeping the illness under control. Obviously, our life events. If someone goes through a significant stressor in their life, they may be more prone at that time to go into a depression or even a manic or hypomanic episode as a result of potentially even not sleeping as well or maybe not taking as good of care of themselves. One of the things I find very helpful to explain to individuals with bipolar disorder is not to just focus on the negative life events or the stressors. Good things that happen to all of us are stressors. Whether it's a move to a new place, going off to college, graduating, whatever that may be, even meeting someone new in a relationship, those can be life stressors. And so those are also things that people need to pay attention to make sure that they're not spreading themselves out too thin, to make sure that they don't get almost emotionally overly exuberant about things and get by with less sleep and then end up precipitating a hypomanic episode, but to moderate things and not to overplay either end of the spectrum, the negative or the positive stressors, but to be aware of what impact those life events may have on your mood. But the actual reality of having bipolar disorder, we could go through and talk about common trigger factors. But the most important thing is each individual patient that I treat has sort of their own fingerprint. They learn to know what those early triggers may be. And so part of the whole process of good outcomes is being able to identify for that individual what their triggers may be.
What strategies have you found helpful in dealing with that trigger?
Don't hesitate to call your doctor and ask, is this relevant? Is this something I should be concerned about? Even if it is a life event, letting others in on this is going to be so important to keeping the illness under control. And again, whether it is something like sleep, whether it's doing travel, people who travel over a number of time zones, it's always good to just check in with your doctor and let them know about how to maybe even take the medications. That's another, potential trigger. Having another medical condition, if somebody gets the flu or gets an infection, they may not have taken their medicine, you should not hesitate to work with your doctor, because when treating bipolar disorder, it's about that partnership and the relationship that that individual has with their doctor. I often tell people I would rather hear about what's going on and try to put any fire out before it turns into a big fire, and be more concerned about that than ignore it and wait until it becomes a bigger issue.
How can you help others who are dealing with triggers or warning signs?
One other thing is also to let others who are close to you be aware of the illness. It may be others that pick up on the triggers before the individuals themselves. They may see patterns of behavior like spending extra time on the computer, staying up later than usual, being more talkative than usual. Those things that the individual may not recognize themselves, or at the flip side, maybe withdrawing more. So having a good support system around you is actually also very helpful. Try to find where that support system is. And it's also so important to have that relationship with their physician, their therapist, whoever else you identify. And it doesn't mean that you have to walk around with a stigma. This is no different than somebody who may have diabetes or blood pressure problems to avoid the stressors that may exacerbate either of those illnesses. Bipolar disorder is similar. So, having the team around you, the people who will support you without stigmatizing yourself around it is so important to those good outcomes.
Thank you, Dr. Zajecka, for talking with us today about triggers and warning signs. Great to have you with us.
Thank you.